So something I didn't know or understand was why, although ongoing care, so working with different specialties like massage therapy, the osteopath, the physiotherapy, vestibular therapy, and many others, were useful in some ways, they also seem to flare up my system counterproductively. So it can be normal to expect a little bit of a flaring up when you've had a physical therapy treatment. Sometimes they're releasing lactic acid, sometimes the muscles or tissues can become a bit inflamed. But in my case, one thing I've learned is that when you have unstable vertebrae, and there isn't the ligaments to hold your vertebrae, even some very gentle massage or some gentle stretching, which could be great elsewhere in the body, can actually irritate those neurological structures. So for me, given the level of instability I had, it not only irritated the nerves, it created slipping, which made those inner two autonomic layers of muscles engage, and so they'd get hyper engaged, they get so tight. And I didn't necessarily feel it right away. I'd feel a bit of relief, and then I'd feel worse later. And so I just keep doing it and doing it. And over time, and now that I'm diagnosed, it makes more sense that that instinct is correct, but the application can make things more flared up because you're actually creating movement in vertebrae that aren't supposed to move. You're impacting your neurological structures, including you can kind of bump up just slightly against the brainstem. And the thing about the brainstem is it does not want to be touched. So I didn't find it like painful, like maybe I got lightheaded. But what I did notice is my symptoms would flare. And because the brainstem is responsible for your autonomic function, you can feel like your heart rate can be a bit funny, or you can be feverish because temperature control, and being a bit feverish, you've got, muscles that are contracting and whatnot. So there's a lot of systems that play in.